Health and care services are facing real challenges at the moment. There's massive underfunding, there's a workforce crisis, and there's growing demand. And people across the healthcare services are thinking about new ways to organise and deliver care to meet those challenges. But we need to make sure that those new innovations are safe and effective, and that's where Brace comes in. It's the Birmingham, Rand and Cambridge Rapid Evaluation Centre. We were established in 2018 with funding from the NIHR, and we've now been given refunding for another 5 years to carry on doing these rapid evaluations. What we try and do with our evaluations is provide timely evidence and learning to decision makers and service providers to make sure that the innovations that are being developed are effective and safe for healthcare providers and users.
Brace has 4 core principles, that's rapidity, responsiveness, relevance and rigour. With regards to rapidity, Brace undertakes evaluations quicker than traditional research, and that also means that we mobilise our teams far more quickly, and we also share our findings so we can impact policy and practice sooner rather than waiting a number of years. When it comes to responsiveness, Brace is responding to the needs of clinicians working across the health sector and also policymakers who are shaping the design and delivery of healthcare services now but for the years to come. And what we can do is make sure our evaluations meet the needs of policymakers as well as a number of other stakeholders. When it comes to relevance, Brace has a track record of working with a range of stakeholders, and namely patient representative groups, to inform different stages of our evaluations, whether it's scoping, design, data collection or sharing findings with a number of groups. And we've done that on a number of our projects from our first cycle of Brace evaluations. And lastly, rigour. Our evaluations meet the high standards of quality expected from those who work within our field, and also we make sure that our findings are underpinned by theory and consider pragmatic considerations when we're actually collecting data with different stakeholders as well.
The Brace team comprises a range of different organisations that all bring different skills and abilities to how we carry out rapid evaluations. At the University of Birmingham, the Health Service Management Centre, it provides the kind of expertise in health organisation, governance and management. RAN Europe provides time-critical skills in rapid evaluation, and they can mobilise really quickly to help us get going and deploy our evaluations quickly. From the University of Cambridge, we've got the Healthcare Improvement Studies Institute, the THIS Institute, and they bring expertise in evaluation methodologies, especially in the area of quality improvement. They also partner with THIS Labs, which is a dedicated research enterprise for providing online methodologies through their Discovery platform. We also partner with National Voices, which has extensive networks with healthcare charities.
So the views of patients and the public is really important in the work that we do at Brace. And it's really important that we have the views of service users, patients and carers. We involve our PPIE group at all stages of Brace projects, from the initial scoping to delivery and dissemination of our findings, and they're also really embedded in the structure of Brace. For example, we have PPIE membership on the steering group.
So what Brace aims to do is to make sure that our evaluations have the biggest and most relevant impact on society, and to make sure our learning really reaches people in the health and care services. This means that we have a diverse communication strategy. We try to keep doing research publications and going to conferences to speak to academic communities, but we also produce things like policy briefings and policy reports for different service-facing communities, and also news media, social media and more public-facing communications that are more accessible for members of the public and service user communities.
Brace is now one of 5 rapid evaluation centres within England who all have diverse skills, strengths and abilities to undertake rapid evaluations on behalf of policymakers and NHS organisations. I hope for the future that we can continue to deliver a number of evaluations on a range of topics that help patients and those working across the health sector improve their experiences and also enhance the quality and standards of care provided by the NHS.